What do you think about the NIH now that you were working there?
Probably shouldn't be saying this out loud. They might have funded a lab in Wuhan, China, to make COVID. And Pfizer and Moderna are just getting a bunch of money from it, from all these vaccine mandates.
Raja Cholan is with the National Institute of Health.
For other vaccines, like measles or whatever, you had to go through several rounds of approval, but these were accelerated through the approvals.
Do you think that the mRNA stuff is safe? Think it's really affected people with the myocarditis stuff?
I think we're all going to learn when it's too late.
I think that's important. The lack of effectiveness of the vaccine product.
Like the 6-foot rule, remember that? That wasn't based on any real evidence that did anything. It was completely made up.
Well, what do you think? Happened with being realistic.
Raja then brings up politics, talks about which political party he prefers and what would happen to him and NIH under an incoming Trump administration.
I think it would be worse for the NIH. I think it would be better for a Democrat to be in office. We sometimes fly under the radar of the really street guys. I don't think it would impact me. I don't think I have too much to worry about. That's not recording, right?
Raja Cholan is with the National Institute of Health, or NIH, and has only been on the job for 2 months.
All the other branch chiefs are 55.
Wow.
And I don't know shit. I know about the subject matter, but I don't know about any of the government, how budgets work or how the hierarchy works.
In his role, Cholan oversees 40 people and heads up the Health Data Standards Branch for a division of NIH called the National Library of Medicine.
So the U.S. National Library of Medicine, you can think of it as the nation's health library. All the major peer-reviewed journals are there, and they have electronic databases, electronic cataloging. They manage the PubMed application that makes all this information available to the general public. They manage clinicaltrials.gov, which is the application that summarizes clinical trial results. And it appears that what Mr. Cholan's division, this health data standards, is responsible for is analysis of visual data. This is X-ray and MRI data, analyze and develop new capabilities that will make these kinds of information and data more generally available for searching.
While he admits he may know nothing about the bureaucracy, he says he knows a lot about public health.
What do you think about the NIH now that you were working there? Obviously, lots of conspiracies about that. My cousin is
about Fauci?
Conspiracy.
Well, I don't, so I'm not, probably shouldn't be saying this out loud. I haven't gotten the latest COVID shots and I'm not going to. There's mixed evidence about if it really does anything.
Cholan then goes on to tell our undercover journalist that people under 30 are more at risk for heart conditions from the COVID vaccine.
For people that are 30 or under, it really increases your risk for heart conditions. The data does show that. I don't even know if these vaccines stop you from getting COVID. They don't.
Really?
I don't think so. It's supposed to make you less sick if you get it. I don't know if it really prevents the transmission of it.
He is speaking casually, candidly, about the risks of the virus, the risks of the vaccine product, particularly as it relates to myocarditis, the lack of effectiveness of the vaccine product. He's saying that it doesn't prevent infection. It doesn't prevent disease. These are statements that I had made back a few years ago that I was called a liar for saying by the Washington Post.
But now there is some evidence out that NIAID, National Institute for Allergy and Infectious Disease, that's where Fauci was the director.
Okay.
They might have funded some labs to do vaccine studies and disease, to prepare for an outbreak. They might have funded a lab in Wuhan, China, to make COVID. But I believe in the science. I don't believe, it seems too much of a big conspiracy. And generally, now that I'm a Fed, people in the government do want to do the right thing. Everyone's there kind of behind this, at least maybe more so at NIH or in Health and Human Services. People want to help people improve health. So I don't know that I believe that these people are all trying to spread a virus and And then like,
What if they were? Hypothetically.
then they should go to jail. If NIAID and Fauci were actually doing this, if the proof comes out that they were funding it, maybe they were actually funding it just to like be prepared and shit went wrong. They were trying to study a virus so that when it did break, if and when it did break, we would be prepared for the response to it. But instead, they accidentally funded the thing that like caused it. I don't know. But hopefully the intentions were good up front. It doesn't like excuse them outright, but I don't know. Like the 6-foot rule. Remember that? Like that wasn't like based on any real evidence that did anything.
Really?
It was just they, and again, I think they were just trying to do the right thing, but it was completely made up. If they had said 5 feet versus 6 feet, right, or 7 feet, like it was all just they just made it up.
Does anyone really trust the healthcare system? Well, thankfully, there still are some good guys left in healthcare, like our great friends at The Wellness Company. The Wellness Company has been with OMG since day one, and now they're proud to introduce the ultimate first aid emergency kit, meticulously created to ensure your access to life-saving prescription medications, personal protective equipment, and other essentials by empowering you to take control of your health journey. Now you and your loved ones will be prepared for the next shortage or whatever they try to pull. My team and I have our kits with us in the field at all times. Don't get caught without the medications you need. The Wellness Company's First Aid Medical Emergency Kit can make all the difference. Order your medical emergency kit now and save 15% by using code OMG. That's twc.health/OMG. Go to twc.health/OMG. Again, that's twc.health/OMG. Now, what's confusing is whether Raja is a villain or not, whether he's a participant in this unethical behavior, whether he's doing his job or just following orders. But we wanted you, the viewer, to be the judge of that.
Do you think that those, like, that the mRNA stuff is safe? There evidence showing, like, myocarditis or something like that?
It definitely increases your risk for that. I think that's well known now. And Pfizer and Moderna are just getting a bunch of money from it.
From what?
From all these vaccine mandates. I think for other vaccines, like measles or whatever, you have to go through several rounds of approval.
Right.
And submit a bunch of data to prove about like side effects and things. But these were accelerated through the approvals to rush them for all of us to get our boosters.
Like,
and they made millions of dollars.
You think it's like really effective people, the myocarditis stuff?
I think we're all going to learn when it's too late.
What would make it too late?
Like it's going to already have been 10 years down the road. And then a bunch of people will have gotten like all 10 boosters.
Why do you not want to get them again?
If I'm going to get COVID anyway, and I'm going to be all right, why increase my risk for the known myocarditis?
The very foundation of journalism is to get answers. A common technique by which to do that is called a FOIA, or Freedom of Information Act request. We've submitted many FOIAs, particularly for body cam footage. But then this government official tells our undercover journalist that NIH is intentionally giving orders to make getting a FOIA even more difficult.
Is there anything that, like, if you found out that you would be like, oh, that would change your opinion?
So do you know what FOIA is? Freedom of Information Act.
Okay. Yeah.
So like the press or whoever can like request from the government, like show us emails or whatever.
Yeah.
This article claims that they were like misspelling words on purpose. So then if there was a FOIA request for whatever, coronavirus, they misspelled corona. They were instructed to misspell it on purpose so it wouldn't return on the search.
Wow. Who's requesting FOIA?
I think it's journalists.
Raja then brings up politics, talks about which political party he prefers and what would happen to him and NIH under an incoming Trump administration.
Well, what do you think? Like, what happened if he were being reelected?
I think it would be worse for the NIH. I think it would be better for a Democrat to be in office.
Why? What makes it up?
There's some like Section F, but I don't even know what Section F means. It's supposed to be proposed cuts to NIH. I think where I work at the NLM Library,
Yeah.
we sometimes fly under the radar
Yeah.
of like the really scrutinized. I don't think I have too much to worry about either.
No, just like the whole connection with like RFK is just like insane to me. Absolutely insane because he just seems like a total.
What happened with RFK specifically?
Well, he's like just super
Anti-vax? Or
anti-vax, like anti-science, like anti-big pharma. You know what I mean? I think he's like Trump has said that he doesn't want to have RFK in his I don't even know. Like, does that make you question?
I don't think so.
Really?
I don't think it would impact me.
I just wonder, like if I was working in that department, you know what I mean? I'd be like pretty concerned. Like, I wonder. Like,
a lot of people would probably get fired, or they would retire, and so then you would just be left with a bunch of institutes and divisions that like are understaffed, and so anything that RFK would want to do probably would just like wouldn't happen. That's my guess.
So Raja questions the vaccine companies colluding, skipping approvals, and creating false guidelines. It all just seems like a bunch of buffoonery. It all seems contradictory. And the question again, is this villainous behavior? Is this corrupt behavior? Is this just government incompetence? To quote Raja, is this just a guy who, quote, knows shit about nothing? But he clearly knows some things about something. And he says he knows a lot about public health. And the real question is, are these the type of people we want in our government making medical decisions? And that question might be answered by the incoming HHS Secretary, Robert F. Kennedy. Stay tuned.
Wait, hold on. Do you know about like honeypotting? People that like get asked on dates and then they get asked questions about their work and then they're like recorded. This is I
what
feel
are you
like
talking about?
now you're like asking me my opinion about these conspiracies. I feel like I'm not supposed to answer it.
No,
That's not recording, right?